topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, South Florida. Little rainy South Florida. Hey, I have got the greatest surprise for you today. You know, some people would just write us saying, do you ever read our emails? And believe it or not, I read every single one of them. You have been asking me for about the last 6 months, why don't you do a show on neuropathy? Well, I would have loved to do it, but we didn't have any openings. We finally got an opening, and I was so lucky to find the top doctor in South Florida with Dr. Andrew Cherry. Good afternoon, Dr. Cherry.
Good afternoon, Steve. Thank you for having me on your show. I look forward to helping many people.
Yes, because I got to, I talked to you before about this, that we do other neuropathy shows around the country. And I got to tell you, I have learned so much about neuropathy. One of the things I've learned is people have no idea about what neuropathy is. And that's why the show is going to be so good. And Dr. Cherry is going to be with us every month. So let's, first of all, tell everybody about your practice.
Well, sure thing. I am a chiropractic physician in the state of Florida. I'm located in Cooper City, Florida, which is West Hollywood near Davie. And I've been practicing for 33 years. And I help patients with any type of nerve problem, muscle, joint, or any combination, anything from the head to the toe, naturally and holistically. When people want to improve their health, they come and see me, and we help them improve their quality of life naturally without any use of any medicine.
Well, to be in practice for that long, you must be doing something right. Dr. Cherry, neuropathy, I have learned it can be very painful, but you can also have numbness. You can also have balance problems, but there's people right now who are watching or listening to the show who might not even know that that's what they're suffering from. So tell everybody about neuropathy and what causes it.
Well, yeah, neuropathy is a very serious condition. And I find that it actually robs people of their independence and quality of life due to the discomforts associated with it. And the word itself means nerve damage or disease of the nerves. And the nerves that are generally affected with peripheral neuropathy are in your extremities. That's why we use the word peripheral. They tend to affect your feet, and the symptoms can work up your legs, and they affect your hands, and the symptoms can work up your arms, and it can happen in either your feet or your hands or both. It's a very serious condition that needs attention as soon as possible.
Well, I'm going to start off with the bad news first, because I have a feeling there's people who have know they're having a problem, but just kind of put it off. What happens if you do not treat neuropathy?
Well, if somebody is actually diagnosed with neuropathy and there is no treatment to address the causes of their symptoms, this is a condition that will progressively get worse over time and definitely interrupt the quality of life. So our goal is to help educate as many people as possible to start treatment as soon as possible so we can improve their quality of life and prevent this thing from getting any worse.
Dr. Cherry, do you ever think about when you hear someone fell in the shower? Because one of the problems that people suffer when they have neuropathy is balance. Do you ever think about, gosh, I wonder if they had neuropathy and lost their balance in the shower?
Yeah, sure, certainly that can happen. Most injuries that happen at home happen in the bathroom.
Yeah.
Yeah, and when it comes to peripheral neuropathy and nerve damage, balance is definitely one of the most common symptoms or involvements that people have due to the inability of the nerves in the feet to communicate properly with the brain, and the brain's lack of proper communication of these messages from the feet. And that's what leads to these balance problems. And according to the CDC, the number one cause of injury related to death is having falls and injuries due to these
Mm.
falls due to peripheral neuropathy. So it's very concerning.
Do you see in your office that there's a certain demographic, like male, female, or age, when it comes to neuropathy?
That's a really good question, Steve. And as long as I've been doing this, it's hard to pinpoint the demographic because yes, it can happen to people over 50, people that have diabetes. It can also happen to younger people. Uh, and one of the reasons, and we can come back to some of the other reasons that people develop peripheral neuropathy can be of unknown origin, and we call
Mm.
that idiopathic onset. Sometimes we just cannot pinpoint the reason. And what I conclude is that for these certain patients that have unknown onset, it most likely is due to something that may have started in the past, maybe with an injury to their hands or their feet, or just being a kid falling off of bicycles and falling out of trees, and some sports related injuries. Sometimes it's really hard to pinpoint what caused it. So I'm always telling my patients, let's not focus so much on, in this case, what may have caused it, but let's focus on, determining if in fact you have neuropathy so we can do
Right.
something about it right away.
How do you determine when someone comes to your office? How do you determine if they have neuropathy?
Yeah. Well, first and foremost, with any condition, we have to do a proper history, review what's going on with these patients in the past, their health conditions presently, what they're going through now, what treatments they're having. And once we get through that history, we have to do a neurological sensory exam. There's a specific testing that I utilize in my office that tests the different types of what we call nerve fibers that communicate with the brain. So that, for instance, you will know if you're, say, standing on something hot, or if you're standing on something cold, or room temperature, even sharp or light touch, like, so if, say, an ant is crawling across your feet, even vibration and balance and so forth. So the proper testing of the different types of nerve fibers is crucial so that we can determine which of those nerve fibers are damaged and to what extent, as far as the level of severity, because that will ultimately determine the diagnosis of neuropathy and what we're going to need to do to start treating that.
Just got our first text in from Molly. She said, I was one of the people who wrote you so many times that you should have a show on neuropathy. I'm so glad you did this. Dr. Cherry, is there a such thing as a stabbing or burning pain?
Yeah, Molly, it's a good question. Yes, definitely.
Mm.
Many patients complain of stabbing and burning pain. When it comes to symptoms, again, there are different types of nerve fibers that transmit different sensations to your brain. And one of them is the type that transmits stabbing or shooting pain, for that matter, burning as well. I mean, there's different fibers that transmit hot and cold and so forth. So if you're having these type of sensations, that is not normal. After all, normal tissue does not transmit pain, and we need to get you back to normal.
Here's our second one. This is really a good question. Uh, Thanks for Ask the Experts for providing a show like this today. I have to tell you, I have neuropathy. My doctor has been treating me with prescription medicine that has not worked at all. How is how you treat your patients different than what my doctor has prescribed to me? I bet you
Sure.
see a lot
Yes.
of those.
Oh yeah, yeah. The majority of people that come to my office have already reached out to the medical community for help. And what I find is that in most cases, not all, but most cases, the medical community will prescribe medicine such as one of them called gabapentin,
Mhm.
or Lyrica, in other words, pregabalin. And these medicines are designed just to dampen the pain and treat the symptoms and not address the underlying root cause of these symptoms and prevent the progression. Unfortunately, this is the extent of what these medical doctors do for their patients that complain of these symptoms. On the other hand, what I do has nothing to do with medicine. We find out what is actually causing the symptoms through the testing that we mentioned before, testing the different types of nerve fibers. And we determine what level of severity it's at to determine the treatment needed. Most everything that patients do to recover is done from home, and
Mm.
there are no side effects. It's comfortable. Actually, patients report that they take a nap while they're doing this treatment at home. We'll discuss that a little further soon, I'm sure. But my job is to find out what's causing the problem. Let's treat the cause, not the symptoms. And that's the main difference between what the medical community does and what I do.
Is it hard to diagnose neuropathy?
Well, you know, listen, it is not. The testing is fairly straightforward and simple. If it's in the feet or the hands for that matter, we use simple tools to test how you feel something that's hot. I use a hair dryer on my
Mm.
patients. And most people, funny enough, see this hair dryer hanging in my exam room and ask me, by the way, what is that hair dryer for? Given that, I don't have much hair. So we use some simple tools, and I use an ice stick for cold, and a tuning fork for vibration, and so it's actually pretty straightforward and pretty simple, but extremely important that we test all the types of nerve fibers.
Listen, I'm going to say this. I know you would never say this, but I've learned after doing so many shows in other of our states that when it comes to neuropathy, not every doctor or chiropractor understands neuropathy. And there's very few doctors like Dr. Cherry that really understand this, that really work with patients. And I'm telling you, you I want you to, we'll be giving out Dr. Cherry's number. We're running it across right now on YouTube. But for all the people listening on iHeart and Spotify and our other platforms, we'll be giving out that number. Be very careful because I have had so many people call into the show that were misdiagnosed by their doctor, their MD. And I just want people to know that no matter where you are here in South Florida, that Dr. Andrew Cherry is a doctor who understands neuropathy. Now, why are the symptoms seem to be worse at night, Dr. Cherry?
Yeah. So symptoms can be worse at night, not in all cases, but most of the time, during the course of our day and our daily lives, we're busy doing what we do in our daily lives, between working and taking care of children and family, house chores, recreational activities. We're busy doing these things. Even patients that are suffering with neuropathy that have some impedance and can't perform everything properly, they're in the course of their day doing what they're doing. At nighttime, when you're settling down and things start to calm down and you lie in bed, actually the daily tasks and daily activities are not so much on your mind anymore as you're trying to wind down. And this is when symptoms tend to act up and you notice them more. A lot of times this happens. Also, as your circulation slows down and you're relaxing, that can take effect as well and increase any of the symptoms, especially if you're laying under covers and your body temperature is warming up. That could increase the burning sensations in your feet or toes, even if your hands are under the covers and so forth. So that's mostly why, symptoms at nighttime can feel worse.
This is from Craig in Boynton. He wants to know, you're talking about sleeping at night. I seem to have restless leg. Do you ever find that restless leg has anything to do with neuropathy?
Well, I do. In fact, I do.
Mhm.
And overall, in general, we're talking about our nervous systems, which is the control center of our body. And if in fact there is interference in the ability for the nervous system to function well, we develop health problems. We're not expected to be able to feel normal at that point, let alone function normal, if there's nerve damage or nerve interference. And since the nerves control everything in our body, including the muscles and tissues in our legs, which tend to be what people feel with restless leg syndrome, we tend to treat that in different aspects. And people tend to respond well to the treatments we offer for that, which can be a little different for each person. But we do get great results. Matter of fact, I have a patient who's 96 years old who
Wow.
came in the office because of neuropathy and restless leg syndrome. And in just 3 weeks' time, she was reporting that she was 70 to 75% better since the start of her
Wow.
treatment. And you can actually see that video testimonial on my website on the bottom of the neuropathy page on my website. You'll notice the very cute and outstanding 96-year-old woman.
Let's give that website right now. We'll give it at the end of the show, too.
Okay. The
What is your
website is www.drandrewcherry.com, and that's drandrewcherry.com. And you click on the neuropathy page.
Dr. Cherry, do you ever have to change people's diets when it comes to neuropathy?
Yeah, well, since the number one reason that people develop neuropathy is from diabetes, this is
Mm.
concerning. And certainly, yes, we always educate people on proper eating habits. That's for overall health. And if you have diabetic neuropathy, yes, we would certainly advise that someone starts to follow our plan with better eating habits. And that will only help them to get even better results with the treatment. We have a simple page on our website as well. It's under the nutrition page that educates people on what you should eat and why you should eat that, as well as what you should avoid and why. And you can simply click on the nutrition tab on that same website.
Any kind of supplements that also help?
Yeah, so part of the treatment plan includes supplementation,
Mm.
and for the most part, this powdered supplementation does a few things. It can control blood sugar levels and helping people with diabetes normalize. It will help reduce systemic inflammation that leads to pain. So anytime there's pain, there's inflammation, and anytime there's inflammation, there's pain. So reducing that is going to help people feel better. It provides antioxidants for cardiovascular health and to help fight free radicals and inflammation within the blood vessels. And it also helps improve or dilate the blood vessels to help increase blood flow so we can carry more oxygen and nutrients to all parts of the body, specifically and especially the very tiny nerves in the hands and feet. It is
Uh,
important, very.
One of the things I've learned in our California show we do with neuropathy is people actually went to their doctor and the doctor told them they have neuropathy and there's nothing they can do for them. And they went to our doctor there and they're about 85% better. Does that surprise you?
Not at all. Not at all. In my experience in seeing thousands of patients,
Yes.
most everybody that has neuropathy, and I say most, not all, have visited a medical specialist and have been prescribed the gabapentin, Lyrica,
Mm.
or even told, there's no cure. You have to live with this, deal with it, and take these drugs to help alleviate it. Our treatment that we offer, I'll discuss that in a moment, has well over a 90% success rate. And the reason is that when you have peripheral neuropathy, you have damage to 3 different parts of the nerves. And those parts include the very small, what I call microvessels that wrap around the nerve itself and supply oxygen and nutrients so that the nerve can function normal like all of our tissues. It also includes the covering of the nerves called a myelin sheath. And that myelin sheath, its job is to allow for the electrical signals that the brain makes to pass across the nerve and tell the nerve fibers, which is the next component, what to do. And so if you have damage to the small blood vessels, it will lead to damage to the cover. That will lead to damage to the different types of nerve fibers, and people start to develop the numbness, the tingling, the burning, the cramping, the electric shock, the freezing, the balance problems, any and all of those symptoms due to the damage to those 3 parts. Our treatment is designed to treat specifically the blood vessels, increase the number of those blood vessels, dilate the blood vessels, improve blood flow and reduce inflammation in your existing blood vessels, and re-educate or revive the nerves that are not transmitting proper signals. And obviously help with the nutritional component, like we mentioned before. We also offer specific type of office treatments or therapy or rehab to address any balance issues and blood flow issues, nerve issues, and so forth. Without utilizing these components, you are not going to get the same results. Medicine does not address these parts. The damage needs to be addressed, and that's what we're doing, and that's why we're so successful at actually helping change people's lives. Now, I want to say most of the time in the first 3 months or 90 days of care, people are at least 30 to 50% better, if not more, in just that short period of time. Treatments can last 9 months to 12 months. It depends on the level of severity that we discover through our exam. It's a slow healing process. We're dealing with nerves that are part of your nervous system, which controls your whole body. So we have to be patient, and we have to be diligent and compliant to what we recommend so people can get those results and have a better quality of life like they deserve.
You know what? I got to tell you, first thing is, when it's a good show, I always know because it goes by so fast. And we've already gotten people with more questions, but you're going to be back again with us next month. And I'm so glad we've got you. Tell people again how they can reach your office.
Well, you can reach us by calling 754-227-9640. You can jump on our website at www.drandrewcherry.com. That's www.dr, like doctor, andrewcherry.com. You can find us on social media. We have a television commercial that runs throughout Broward and Miami-Dade counties. We're available for anybody, anytime.
Well, I got to tell you, we got a call about 3 days after I spoke to you. It's a very big chiropractic clinic throughout South Florida. And when I told him that we already found somebody, it was so funny here. He said, "We're the biggest." I said, "I don't care. I want the best." And we did that with Dr. Cherry. And him and I go to the same barber, by the way, too. For those of you.
Right.
Dr. Cherry, have a wonderful Christmas. I can't wait for our next show next month. We'll see you soon.
Thank you so much for having me. You have a great day, and thanks, everybody.
Dr. Andrew Cherry. We're going to go to break. We'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.